Good evening, Malden. And we are here tonight to provide you with another COVID-19 update. I'm Gary Christenson, Mayor of Malden, and tonight I'm joined by, we have three panelists, not including our Director of Communications, Ron Cochran. So we have Kourtney Nickerson, Chairperson of the Board of Health. We also have Chris Webb, who is the Director of the Health Department. And then finally, we have Christian Lanphere from Cambridge Health Alliance. So they've been with us before, and we wanted to have them back again, particularly with what's going on across the city, the state, and the nation. So why don't we do what we always do, which is first thank Malden Access Television for hosting tonight's meeting. And once again, thank Ron Cochran, our Director of Communications, for organizing this event. So why don't we first hear from our panelists, and then we'll get to the most important thing, which are your questions. So Chris, why don't we go to you first, Mr. Webb from the Health Department.
Good evening, everybody. It's great to be back on again. I think it's a good time to be on. I'll start with the updates for today. The number of cases in Malden has gone up to 3,011 with 92 deaths. We are currently waiting for tomorrow's new numbers to come out. We are still in the red zone at 38 positive cases per 100,000 with a positivity rate of 5.19%. I think that number is going to rise dramatically, but I would ask that everybody keep in mind that a lot of people went and got tested from Malden, which is very good. And our numbers are really respectable based on the number of tests that have been done. So we'll have some more information about hospitalizations and the vaccine later on.
Okay, and Mr. Webb, if people want to reach you after the show, what's the best way?
Best way really is to email me right now, and that would be at cwebb, W-E-B-B, at cityofmalden.org. Or call the office at 781-397-7000, extension 2053.
Okay, thanks again for coming on, Mr. Webb. Now let's go to the right. Dr. Nickerson, welcome.
Mayor, thanks for having me. Hello, Malden. It's great to be back. Thank you, Malden Access TV and Ron for hosting tonight and coordinating all of the questions. It's great to have this community outreach. So just to remind you guys, I'm a research scientist. I am proud to serve on the Board of Health for Malden, and my background is in host microbiology with a specialty in infectious disease. So my goal here is to help translate some of the deep science that's out there, and also to have a perspective that's similar to your own. I wrestle with the same hard challenges and questions of, do I send my kid to daycare, and what are the risks from going to work day to day? So please keep that in mind when you reach out tonight. We do have some great updates on vaccine status. A lot has happened. You've heard about changes in rollback of status to try to keep these numbers under control. Before I give up my soapbox, I do want to say to the people that I've talked to that when I've asked them about their Thanksgiving, that kind of wince and say, you know, it was lonely. Thank you. Thank you for staying home this year. You did your part. You've protected those neighbors, the ones that that might not have all the resources themselves. So thank you. We're a community and we're in this together. And we'll keep fighting.
What's the best way to reach you, Doctor?
Go right through Chris, shoot him an email, and then he'll follow up with me. I do need to do something to make myself more accessible, and I'm sorry about that.
No, it's all good. Okay, very good. Thank you. Mr. Lanphere, welcome.
Good evening, Mr. Mayor, and good evening, Malden. My name is Christian Lanphere, and I am the the corporate emergency management director for the Cambridge Health Alliance system. And we are on the verge of probably beginning vaccinations of prioritized healthcare workers beginning next week. There is a lot that's being considered and worked on in that. But at the same time, we're also prepping for a second surge in patients to the hospitals in Massachusetts at this moment.
Okay, very good. All right, let me ask you each a question that I'm sure is on everyone's mind. Vaccine is here tomorrow. Mr. Webb, you're taking it. If not, why not?
Absolutely, I'm taking it. Absolutely.
Okay. And how about you, Dr. Nickerson?
As soon as I'm eligible, I'll be right there in line. And I think this is a really great question, because I think there's probably going to be a lot of hesitation about taking a vaccine. And why? Because we don't have the long-term data. But honestly, I think to kind of share the perspective that I share with my family, which is helping them to make the decision, is we don't have long-term data about the virus either. This is a brand new virus, and we do know that getting sick with the virus is bad, can be very bad. For some people, they don't even make it. And when we look at the data for the vaccine, we're not seeing that. We're seeing phenomenal numbers, phenomenal protection. And I can read off some of that information a little bit later, as you know, the wonderful people of the world have translated some of the documents that the FDA and even just the Pfizer study they've put out to sort of tell you what to be aware of. And the numbers are really good. You never see data this solid, and I'm really, really pleased. And the other thing I'd want to point out too is Malden's a really diverse community. When they look at the numbers, they do comment on there that there was no significant differences across race or ethnicities. Right. And while we don't see as robust representation to reflect really the diversity of of Malden or the US, you do see representation of all different populations and ethnicities, and that's really important to consider.
Very good. Mr. Lanphere, are you taking it if it's made available to you
tomorrow?
Yeah.
So I think how we're, one thing I think people should know is that we're not doing this because the government has said it's safe to take it. We're not doing this because Dr. Fauci said take this drug. We actually, started with a team, our medical director for occupational health, who's a full professor at Harvard School of Public Health, Dr. Luann Bruner-Murtha, who is our chief of infectious disease and our chief pharmacy officer. We tasked them with reviewing the safety data. So the safety data has been coming out now, but we took the information that Pfizer presented to the British version of the FDA and all of the information that was submitted to them. We took all of that safety data, and they've been going through all of that data. And so some of the things that you're seeing in the media now are, this was known at the time of many of these clinical studies, and we have determined that it is safe for us to provide the vaccine to our staff. And just as importantly, they've also acknowledged that, they would take it as well. And so, while I won't, we are beginning the vaccination process next week. Obviously there are, lots of questions people have, but we are going to prioritize this as the way the state has intended it to be prioritized. And so we are going to, someone like me, we're not going to skip the line. When it becomes our turn, like Dr. Nickerson said, when it becomes our turn, we'll get it. But we are going to make sure that those healthcare workers who really are at the most risk are offered the vaccine first. And we must remember it's a 2-dose. Pfizer and Moderna both are 2-dose. So this presents some new challenges that I think are different than what we're used to. So there's a lot of work here.
So let me ask you, speaking of that, the 2 doses, how far apart are they?
So Pfizer's vaccine is 21 days apart and Moderna is 28 days apart.
So if someone gets a shot, that first company, Pfizer, you said 21 days, you'd come back and get the second dose?
Yeah. And there's different.
What if you didn't, Mr. Lanphere? What if you only got one and said?
So that's out there. And one thing we need to be clear is we are not making this mandatory for our staff. This is not going to be a mandatory vaccine. And we are not going to make the second dose mandatory. What we do know so far is that the first dose actually gives pretty good protection. But the manufacturers of feel that the absolute protection is provided by 2 doses. So, okay. There's going to be, I think there's a lot of unknowns for us. I think that, there are so many questions that we still have around, well, what if the staff get the first dose, but they don't get the second dose? Right. The way the state is distributing this is it's a very complex process that they're going through with this. For us, I think it's a little easier because we're in a closed system, whereas there are employees, we can get a hold of them, we can contact them to get the second dose. For my colleagues in public health who have extraordinary challenges of getting people back for the second dose. I do not envy public health. I think that they've got good. I think, just like they always do with any robust program, they will plan this one, see this one through.
Okay, when should the community expect to see the vaccine available? Mr. Webb?
Yep.
Let me go to Webb and I'll go down the line. Mr.
The
Webb?
community at large, it's going to be a 3-phase rollout in the state of Massachusetts. So phase 1 is all those people we were just talking about, and that would start in December through February. Then there's phase 2 with people with comorbidities, at least 2 comorbidities, early education, K through 12, and then essential workers, bus drivers, grocery stores, people that we need to keep the everyday life going, adults 65 and older, and then individuals with 1 comorbidity, depending on where we are in that process. That'd be February and April. And then phase 3, which starts in April to June, which is kind of where we always thought it would be, is vaccine to the general public.
Okay. Dr. Nickerson, now tell the community what the shot actually means. It doesn't mean they can never get COVID again, right? Isn't it to prevent hospitalization and some other things as opposed to outright never getting the virus again?
Right. So just like when you get your flu shot, you're not protected from the flu infecting you. But what happens is that it reinforces your body's immune system so that it can fight the flu faster and better. So that way, when you get sick or you get infected, instead of being sick for 3 weeks to a month, which is what could happen with the flu, your course of disease is much shorter. And this is a net win for everybody because now you're not contagious as long, you're not spreading the virus to others, your body is bouncing back, you're back to work a little bit faster, and you feel better sooner. So with this vaccine as well, similar things are happening. It's a little bit different from the way traditional vaccines have worked, but it's showing remarkable efficacy. Some of the numbers that are from the Pfizer study say that after that first dose, you've got about 50% efficacy, which happens about 2 weeks after that was administered. And then if you get that second dose, that efficacy goes up to 90-something%. So those are really great numbers, really robust. It says your body, it has mounted an immune reaction that will help protect you if you are exposed to the virus. And that's the goal here. One thing to also be aware of is that you will have a bit of a reaction. They did see common adverse reactions with the vaccine when it was actually injected. So people do see some injection site pain, some fatigue, headaches, muscle pain, chills, joint pain, and fever. And all of those symptoms are good. It means your body is responding and it's doing what it's supposed to in order to protect you from the illness. So if you get your vaccine, don't be alarmed that you have some mild symptoms. They're going to be expected, but pay attention to the information that they provide you when you are getting your vaccine. And if anything feels out of the ordinary, follow up. That's what your public health professionals and your doctors are there for. They want to make sure that you stay healthy.
Now, doctor, is that different from reactions you might get when you get the flu shot or the shingles shot?
Nope, they're very similar.
Are there adverse? Very similar. Okay, so it's not unusual. Okay.
No.
All right, Mr. Lanphere, you mentioned the word mandatory. It is not mandatory to get the shot right now, correct?
Correct. It's not mandatory, and we as a health system are not going to make it mandatory. We are following most other health systems. I haven't found a health system in Massachusetts yet that is going to make this a mandatory vaccine. And keeping in mind, this will be under an emergency use authorization only. So there are other limitations to that, but there will be no mandatory requirement. However, regardless of the staff getting the vaccine or not getting the vaccine, the mask requirement will continue.
So we're going to come back to that, but let me ask you, Mr. Lanphere, if the governor is requiring students to come to school with the flu shot, do you see that happening at some point with the COVID shot?
I don't. We are, this is the first.
Why not?
Well, I think that there's still a lot out there. I think what Dr. Nickerson, pointed out was absolutely correct. I mean, there's not, enough time with it. Again, I think you're right. We haven't done a lot with COVID either, but, we do need to keep in mind that COVID is a SARS. And, AstraZeneca is one pharmaceutical company that actually has been studying SARS vaccines for 18 years. So it's not really that we've just, we just started. There has actually been work that's been done for, many years around a potential, vaccine. It happens to be AstraZeneca. It does not happen to be others, but we have been playing in this environment for a little bit of time. But it's still it's so new. There's no way that we would make this a requirement. We do make influenza. This is actually the first year, which I'm very grateful for. It's taken us many years to get this through, but this was the first year that our organization made getting a flu shot mandatory for all employees.
Christian, how important is it if you get the shot that you get the second shot when you're supposed to get it? I mean, if someone gets it and then they feel okay and they feel like it's working and they say, well, I'm going to put it off for 6 months. Does that then defeat the purpose?
So we feel that that's our worry. I mean, the manufacturer, the scientists who've been, this is their expertise, and they feel that this is the best protection. I'm not sure that any of the clinical studies that I'm aware of, maybe Dr. Nickerson maybe knows a little bit more. I have not seen in the clinical studies where only one dose was provided. And I'm not sure if other people, got one dose and fell out of the study. I'm not close enough to it, but we do worry what that will mean, for a number of reasons. One, it's still a very limited resource. There are people who are hesitant, but there are many people that want to get in line to get it. And I think we need to be mindful that we have a very limited commodity that we need to preserve for the greatest good. And, if someone's only going to get one shot, I mean, there is some limitations, especially if it doesn't provide the full immunity that, the manufacturers were hoping.
Okay, very good.
So,
okay,
I can't speak to it any more than that.
All right, let's go back to Mr. Webb. So Christian mentioned, that you get the first shot, you get the second shot. In between, people will still be required to utilize the measures that have been in place for the past several months. Do you want to talk about that real quick? So just because you get that shot doesn't mean you stop wearing the mask. How come?
Well, because there's going to be the rate of vaccination it's not going to be instantaneous. So there's the same population is still walking around out there, and the same population that hasn't been infected is still out there. So you don't want to take the opportunity and keep in mind, once you get your first shot, you're still susceptible for the next 21 days, just at a higher rate. Your safety goes up, but only, I would say, marginally, because there's other factors that are going to be involved with that. I think,
Chris, Dr. Nickerson said 50%, right, on the first shot?
57%, I think, and then it's, up to 95 for the second. But it's super important that the second shot be taken on or about the 21st day as humanly possible. And if we do it in a large scale way, we will have clinics starting on day one, and then we'll have the second day clinics. We'll have those in another location, another drive-through probably. And that way we'll never mix the two. We'll always have these stations open so we can get people through.
Okay, Dr. Nickerson, how long do you see us wearing masks and practicing social distancing? Are we talking months, years?
Yeah, probably months. I think I saw an analogy that equated to sort of the vaccine being distributed and our society kind of rebounding, similar to how we thought out from the winter. We don't wake up one morning and it's immediately summer. It's a slow trickle, and spring, it takes time for things to bloom. If you think about that, it's going to take time to get the vaccine distributed. It's going to take time to return back to sort of normal health and steady state. So we're going to really need to keep using the mask wearing, hand washing, social distancing, the same tools that we've had all along. And the reason we haven't changed tools is because they're effective and they're doing a good job, and they're our best tools to helping to stop the spread and protecting each other.
So you see that going through the spring, summer, maybe fall?
There's a good chance. I mean, I would just, we're comfortable wearing the masks. It's
Right.
routine now. let's
Right.
just keep doing it. Keep distributing the masks. I love seeing Mask Man out and about. See, he's doing a great job.
Yeah, I'll tell him. All right, on that note, let's take a few questions from the viewers. So do you have any in the queue? Ron?
We sure do. Yeah, we always like to first start off by reminding folks how they can get in touch with us to ask questions. We do have several questions that have been queued up, so that's great. But we still always like to take live questions, and there's a couple ways you can do that. So first, you can call into the studio. If you're sort of old school and you like the call-in method, you can call 781-388-9394, or you can certainly jump on to any of our social media channels and send us a question that way. We have a thread going here with the questions. You can respond in line. You can also post your questions inside of the YouTube stream that Malden Access Television is currently running. So I'm looking all around for these questions, but there are plenty of questions. I'm glad, you certainly covered actually quite a few that were floating out there, but there's obviously still plenty to go. So let's start out with our first question, which is, and Chris actually just recently touched on this, when the vaccine does come to the broader group, so let's just say the everybody else group, will the vaccine be distributed through the corresponding cities, as in the public health department, or will they go through typical channels, hospitals, CVS clinics, etc.?
Yes, they will be going through our hospital providers. We filled out documents just last week to make sure that happens. Our resource will be Cambridge Healthcare Alliance. They'll be carrying the bulk of the material. We're not sure how that looks yet as to what locations that will be at and what what our responsibilities will be between the hospital and maybe a CVS or other, but that will all be told to us in time. But we have plans to be able to vaccinate as many people as they can give us vaccine for in a mobile fashion so that we can manage. It will work. It's important that, people be patient though. I want to really press that issue. These are approximate times and they're going to change. So please don't take our word from April, May, or June, but somewhere around April, May, or June, we'll be able to vaccinate anybody. But you're going to see the demand is going to dictate how the response goes, and it's hopefully the demand will grow.
So Chris, you see people having multiple options to get the shot, meaning they potentially could go to CVS, Walgreens. There could be a clinic run by the health department. They could go to the hospital. Is that what you're suggesting?
Yeah, I would think that depending on demand and the vaccine availability, you could even have the National Guard doing in various locations. I definitely expect CVS, Walgreens, and the larger pharmacies to be involved. Absolutely. Ambulance companies, fire squads, if they can get the right certification or an emergency certification. Of course, our office. Yeah. So yeah, there's a number of ways to do it.
If I could chime in, this has been on
please.
Chris's radar. This has been on Chris's radar since early this summer. He was, okay, well, we are going to need a vaccine. We are going to have a vaccine at some point. How do we get it to our people? He's been researching options. He secured a drive-through tent to make sure that we could distribute this vaccine when it becomes available and when it becomes a responsibility for us. So because Chris won't toot his own horn. So I think the people, it's important to know that he's looking out for you and he wants to make sure that everybody has access to this when it is available.
All right, Chris, when they do get the shot, and maybe we'll go to Christian, might have some info on this. Will it cost?
My understanding is no. COVID vaccine will be covered by the government. It has a cost, of course, yes.
Right.
But to charge the public would only be doubling the
purpose. Yeah. So no copays, none of that, right?
No, none of that.
And Christian, that's your right.
Just like now, some facilities will try and bill you, and it's an administrative cost. You do have an obligation for the administrative cost. You don't have an obligation for the vaccine.
So the vaccine itself free, but there could be an administrative cost for administering
Yes.
the shot.
Yes.
Christian, that your understanding on your end?
Chris, yeah, Chris said it absolutely correct.
Okay, very good. So Ron, I think we answered that question, correct?
That's correct. Yes, we can definitely move on. So let's talk a little bit about we're coming off of Thanksgiving. We're at that period of time where we were told that if there was going to be an uptick that was the result of Thanksgiving, we would know by now what the data is. So let's talk about that. And then if you could elaborate on upticks in general, that we keep hearing that upticks now is worse than the one that we experienced last April. And I guess, why is that? Is it because we have knowledge of it now? Is it because it's more severe? So maybe you could elaborate on that. So again, just to review, are we in the midst of an uptick because of Thanksgiving, and how bad was it? And then if you could elaborate on why, or if it is worse than it was last April.
Well, first things first, right, Chris? We will know tomorrow night what the impact was of the Thanksgiving Day weekend, because
We'll have a mathematical measurement, yeah.
right, because Chris has told me they look 2 weeks back. And so tomorrow will be exactly 2 weeks from Thanksgiving. So I think everybody should tune in to tomorrow night's numbers, which we'll release. What time, Chris? Maybe after 6? 7?
Yeah, they float somewhere between 6 and 7 p.m. typically.
Okay, yeah, so we'll post that as we always do with the numbers. But Ron, that's when we'll know for sure, what transpired during Thanksgiving Day weekend. And then the other question was what we're going through now compared to when we first discovered the virus here in the United States back March, April. What are your thoughts? Have we surpassed where we were originally, or?
No, I don't think we've surpassed it. We are sneaking up on it. I have another screen open and I'm looking at the capacity of the hospitals by region. And the numbers are changing pretty quickly. And this is not the most active of websites, but it is the state website. And right now we're in the Northeast region. We have 100 non-ICU beds in our region available right now. Boston got 81% of its beds filled. The entire state, 81% of the beds is also filled. More disparaging news for anybody around in the Northeast region, which is where we are. The ICU beds in this region are 100% filled as of right now. The state has 65% of the overall count of ICU beds. Over 50% is full now. And we haven't even gotten into the true infectious period where people are going to really start being symptomatic and start wanting more testing. So our numbers are going to climb, and people who have been tested and are positive should really start to isolate and stay that way if they haven't, because they're going to likely come into an very infectious period right now.
Okay, Dr. Nickerson, now or March, April, which was worse? I guess they're both bad, but
yeah. I think it's kind of fruitless to compare the two, because if the hospital beds are filling up, that means that there aren't resources to treat you if you get sick. Right. So again, the name of the game is always prevention. Public health is all about preventive medicine. What can we do to keep people healthy and not react to people getting sick? So I think Christian can weigh in more about what resources are available. But if you wear your mask, social distance, wash your hands, stay at home if you can. And those of you who did not travel for Thanksgiving, thank you so much.
Okay, Christian?
So what's interesting is that, the region that Chris is referring to, we're the next town, literally we're the next town over, and we're in a different region. We're in the Boston region. But the outcome is the same. We are currently, all of our ICU beds are now full. But it's important to take into context that we are seeing where our systems are being, those beds are being taken by both patients who are non-COVID, who are really sick. Again, this is our busiest time of the year anyway, especially around high flu season. But the beds right now are being taken by both COVID and non-COVID. But what's important about that is that a person's laying in that bed and that bed's not available. And so when someone with COVID needs it, it may not be available. So we are getting stressed, and we're stressing pretty fast. The Boston area, which has the most number of beds, I mean, granted, because of the tertiary care hospitals that have had larger capacity, that window is closing very, very rapidly. I can say that what we are experiencing, which is what similar systems are also experiencing, is that there has been a larger number of patients who've been needing the med surge beds rather than the critical care beds. I think in March and April, when people were not wearing masks, people were getting a heavy viral load, which was putting them in the ICU. This time around, I think because people are wearing masks, people who are getting less viral load, and so they're not getting as sick, but they still are requiring hospital level of care. We're not admitting as many people, but the beds are going fast, and we are staffing all of our beds to to a census that we're not used to. It's important to remember that we are also, the state is requiring all of the hospitals in Massachusetts to dramatically reduce surgical volume beginning Friday morning. We will be shutting down, elective. And when I say by elective, we want to be careful with that term. These are scheduled elective procedures that are invasive, that can wait, will be procedures that are going to be canceled. There may be other elective procedures that need to continue because they will do more harm if the patient does not get that procedure. So we do need to be careful. As in the spring, I mean, it was a pretty blanket cancellation of all elective procedures except urgent and emergent cases. This time around, it's becoming similar, but there's some nuances to it. So I think it's best to reach out to your doctor's office to find out if your surgery is still going to happen, if it's not going to happen. But we are going to use those spaces to put additional surge capacity into. We're going to redeploy the nurses and likely some of the surgeons as well into other parts of the hospital to take patients. We are looking at some of the options we're looking at is if a patient really probably needs maybe a day or two of hydration or fluid, but doesn't really need the intense requirements of being in a hospital, we may consider transferring them to the DCU, the Worcester DCU Center, or up in the Northeast region that is going live with a field hospital. Those are considerations we are making to help make room. There has been an effort across Massachusetts through the State Department of Public Health of trying to balance, we call load balancing, of trying to load balance the beds so that no one hospital system is so overwhelmed that patient care is compromised. But there are a number of measures. What I don't see this time around, and again, we were a hospital system that was hit extremely hard. I think the hospital that's being hit the hardest right now is Lawrence General up in the Northeast region. They are being hit very hard. The patients don't come across as sick. They're not coming across as sick as they were. There are certainly patients who are very sick. I'm not saying that none of them are, but in March and April, it was just, these poor people were so sick. This time around, they're sick, but they're not as sick as they were in the spring. One, I think it's because they're not getting as much viral load from the masking. But two, we're also seeing people who don't have COVID, but have other comorbidities and other medical problems that are taking up some of the hospital beds. And I've always said, anytime someone leaves their home, people are bound to get hurt. And that's when our beds are, our busiest. And if you noticed in the spring, when people were home, people didn't get hurt. Those beds were solely reserved for COVID patients. And so it's a little different this time. It's hard to compare them because I just think they're very different.
Well, one thing that you and your colleagues have done a tremendous job on is the preservation of life. I mean, if you look back during March and April on the bar graphs on the state website, I think at one point we were averaging 200 people dying from the virus. And even now with the way the numbers are, that is way down from where it once was in March and April. So, hats off to you and everyone else for being able to, figure out a way to keep people alive. So, Ron, let's go back to the board and get another question.
Sure thing. So our next question comes from our stream over here on YouTube, and that is from Kristen. Kristen asks, do we know yet if this vaccine will be a yearly thing like the flu shot is?
Okay, Chris?
You know what? I don't know enough about it yet. I don't know that it's been. Dr. Nickerson probably has more of that than I would. My focus is blinders on. What do I do in the next 18 months? And I'll watch the rest later on. So if Dr. Nickerson could pitch in, I'd greatly appreciate it.
Too early to say, Kourtney, or?
I don't know yet either. I don't know. I haven't kept up with it as well. I think a lot of the focus is on what are we going to do to handle the situation right now. I think there was some early speculation that maybe it would be more seasonal. I don't know if any of that's panned out. Like Christian said, the research with SARS was ongoing for a very long time. That's why we fund research and we keep people doing it, because we never know really what's going to come up. So it's really important. And from that information, they were able to build a lot for this vaccine, but whether or not they're going to see cyclical events with this virus, it is so widespread now, we can't really predict. There's a lot of unknowns.
Okay. Christian, do you want to weigh in on that?
Yeah, I'm going to follow them. It's a common question we get from our staff, and the answer is we just don't know.
If you had to guess, would you venture or no?
I just don't know.
Yeah.
I don't know.
Okay. Ron, back to the board.
Sure. Our next question is in regard to the antigen tests that had been talked about in our public schools. I know Malden was identified as one of the districts. And to be clear, it wasn't just the public school district, but it was also charter school as well. It was just our city. So maybe the panel could explain what all the antigen test process is and whether or not is it live, and if not, when is it going live?
Okay, Chris?
The Bionex program is not live right now. We will be an active member in it. Typically, we'd need more of our population into the buildings first. The tests are in the state. They're ready to be distributed. When we go to either full or hybrid, then the program will be in place. We notify the state when we plan to do that, and they will ship us the requisite amount of kits to make sure we can do it. Keep in mind, that's not a program that tests every school student when they go into school. It's a quick 15-minute test to check students and staff who are showing symptoms. So we can decide what we can narrow down the close contacts, obviously, and slow the spread dramatically. So in each school will have it, and our office will do our level best to make sure everybody's properly stocked, and we'll work tightly with the school nurses, as we always do, to make sure that goes well, and they're excited about it as well.
Okay, Kourtney, I'm a student. I have a cough. They send me to the nurse's office. I take this test. It comes back negative. Am I back to the classroom, or I guess it depends on the circumstances, or is it I have to go get a further test? I don't know if you can answer that, or back to Chris.
Yeah, I don't know if I can answer that one. I think the nurse would be looking for any other symptoms. I think it would depend on the test itself, because tests generally have values that tell you how reliable they are. I think some of the early concerns with the antigen tests were that there could be false negatives, but don't quote me on that because I don't know if I'm remembering exactly. So that, I would put it more on the nurse and have some follow-up questions and stuff before making that call.
All right, Chris, I saw you nodding. What do you think?
Yeah, there's a whole process around the Bionex test. They will interview the staff person or the child, and they'll gauge based on what the school population is going through as far as colds, allergies, whatever it might be. And there's a checklist, and there's just a do these things add up kind of thing, just so you make sure you go through and you've got everything. Typically, if someone comes up negative but is symptomatic, they're going to be sent home for at least 48 hours. see if they can. And then when they come back to school, we'll give them another Bionex test. If they're negative, they'll go to class. It'll be a process like that. They won't be, having to get an appointment somewhere or anything like that. So unless they're showing strong symptoms, and even then, like I say, the nurse can make a determination based on what else is going on in the school. Now you need to go get a PCR test. If you come up positive, you're going to leave the school. We're going to do the close contacts. Those that need to be tested will be, and of course that person will be quarantined for whatever time period is applicable. There's a different time frames, and we don't want to get into that right now because it's a whole night of conversation. But it's all laid out. The school nurses are well aware of it. They'll be getting additional training, but they're well up to speed on how the test actually works.
And just for clarification, Chris, because it was mentioned Mystic Valley, given that they are currently both hybrid and many are there full time, will it be deployed to them?
I don't see why it wouldn't be. Yeah. As a matter of fact, now that you mentioned that, I will look into whether they've got a supply or we can get a supply and get them actively enrolled in the program now. I don't know. And I'd like to do that with Chevrolet as well.
That's true. Chevrolet is, yeah. So, okay, I think that answers the question, but we're going to go ahead and move on to our next one. We do have a caller now, so we're going to take our first call of the evening. Kevin, go ahead. You are on the air with the panel.
Hi, Kevin.
Hi, good evening. Hi, good evening, everyone. Good evening, Mayor.
Hi, Kevin.
Yes, sir. Hi.
So it looks like we may be having some technical
Can you hear me?
difficulties there. We'll wait to hear from the control room to see what happened with that. But in the meantime, we definitely have more questions that are queued up that we can go to.
They can hear me.
The question about the most recent rollbacks that the governor announced. So it's a two-part question. One is, does the panel, so just to clarify, what was recently came out from the governor was that all communities are rolled back to step one, correct, of phase 3, which Malden was already in. So the question then is, what is different about our behavior and our restrictions with these most recent rollbacks? Again, everybody's now with us. How is that different? What is different about it? And then does the panel think these rollback changes will be effective?
Okay, Chris.
Well, like you said, we were put into step one, phase 3, when we turned red in the early invention of the coloring system. At the time, it didn't make a lot of sense to me, but in comparison to other communities, I think what the newer editions of the 9:30 closure and the reduction indoors, reduction outdoors, the theaters, the entertainment, I think all of those reductions are important. I think they will have a bigger impact than just rolling back to the standard step 1. Step 1 is really just, all it did was reduce the numbers of people. Whenever you're not excluding a number of people, you're not doing the right thing when it comes to a virus like this. So this will have more of an impact, and hopefully people will look at it as, they're measurable steps. I need to start taking more personal responsibility myself and, do whatever I can to protect myself and others.
Okay, Kourtney.
I agree with Chris. Personal responsibility right now is a big one. I think there's a lot of variables at play here. We're worried about, the economy, or about restaurants, but we also have to be worried about our people. So please stay home. Please order your takeout and take it home. Do those little things, social distance, wash your hands, the same tools like we've had the whole time. And it is a bummer to see kind of our, our mainstays of our day-to-day being taken away a little bit again. But remember, we weren't back to normal. We weren't even close to back to normal. The pandemic is still ongoing, and it's not going well. So we need to respect these rules, and we need to take everything seriously, because that is what's going to get us out of this scenario, hopefully alive.
Okay, Christian, you want to add anything?
I would just say that that our healthcare workers are tired. They're exhausted. I think, like many other people, I think we are no longer that offense. We are the last defense. The offense now belongs to the community at large, and that means do your part, wear a mask, social distance, follow fairly simple procedures laid out by our public health experts to help combat the virus and help protect your family members and your friends. I think that's the best we can do it now.
Yeah, just from my perspective, this has been a lot more challenging because in the spring you had those safety nets that both the state and federal government had in place for people who were going to be impacted by some of these decisions. I don't see that this time around, at least not yet. And so that is what has me concerned, that if we are going to do what we did back in March and April, how do those people support themselves? So that's why we've been suggesting during some of the Metro Mayor calls that if we are going to start going backwards, we must have those safety nets in place in order to do that. And so some of the programs that have been in place, I think they're expiring at the end of the calendar year. So we've been urging that we need to have those back in place or continued, if we're going to start taking some of these measures. That's what, from our vantage point, that's what we're hearing and seeing. For example, there is one business just recently that was impacted by the 9:30 deadline or timeline at night where they had to close. They ended up laying off 25 employees as a result of that one change. So, unfortunately, those people still have that safety net from what I understand. But if those programs expire and there is no new program or a continuation of what's been in place, then I don't know where we go from there. So that's just from our end, what we're dealing with, trying to find that balance. Fortunately, we're continuing to, move forward with rental assistance and eviction prevention, working with Alex Pratt and Debbie Burke from the Malden Redevelopment Authority. So we have that. But I think the big one that they have to figure out are those stimulus checks and the continuation of unemployment insurance, if we're going to start going back to where we once were in the spring. So, Ron, what do we have next?
Okay, I think we're still experiencing some technical difficulties with our call-in. And I know Kev is a frequent caller. So actually, Kev, if you could go ahead and message us over on Facebook. I know you've done that in the past. We'd love to hear his question because he always has a great contribution. If it's the same Kev.
Let's move him to the top then when he does.
Yeah, we'll do.
Else, Kevin?
Yeah, in the meantime, so I love this question because I don't think we've covered this since day one. And that is we've really discussed preventative, always preventative. And when we've done so, we've talked about mask wearing, social distancing, things like that. Well, inevitably, obviously there are people that even with the greatest care still contract this illness. Going across the panel, what have you observed science-based that would be the best possible thing for someone to do recovery-wise? And so, for instance, my personal experience, I've heard things like, vitamin D and, I don't know, cold showers, any order of number of things that are out there in a million articles. But is there anything that the panel can suggest, science-backed, that is helping people recover quicker?
Okay, Chris?
Quicker is still a subjective term as it relates to this virus. Some people recover very quickly and feel great. Some people recover somewhat and it lingers longer and longer. I can say that because my wife is one of those people. She's still lingering with symptoms, and she was considered, she was negative 2.5 months ago. So it can be a long road. I'm sorry, what was the question?
Yes,
But
yeah,
rest,
preventative
anything
and or
anything you would
yes,
do for any other virus.
yeah.
Rest, liquids, antibiotics aren't going to help you. But rest and movement. This is one of those viruses that if you don't move, it's going to affect your respiratory system or could affect your respiratory system. So you want to exercise that. I'm not saying run anywhere, but move daily. Don't get stuck in bed with this virus. Get up, use the bathroom, move around as much as you can. It may only be 10 steps a day, but those 10 steps may be the difference between you going into the hospital or staying home. So that was my experience watching it, my wife go through it. It was very important to eat well as you can, rest, and take in liquids.
Okay, Kourtney?
I think what Chris just said is really interesting because I'm a little out of touch with what exactly they're recommending people do to help recover faster. But I do know that some of the comorbidities associated with, which is being overweight or obese or out of shape, are some of those things that you can address now to sort of set yourself up to be better if you do get sick. So if you can start looking at your overall lifestyle and get a little healthier that way, that could be advantageous. There were some studies about vitamin D. It suggested that if your vitamin D levels were low, it was correlated with more severe disease, but it was just a correlation. It wasn't causation. And it wasn't that once you were sick to take additional vitamin D. So some people have added vitamin D into their day-to-day routine as maybe something that could help you in the future, but I don't think that data is as sound. And if you do have any questions, talk to your doctor. You can get your vitamin D levels checked and they can come up with a plan for you as well.
All right, Christian, what do you think?
I want to talk a little bit about what Dr. Nickerson said earlier. I think one of the things that we saw in the spring was the obesity rates. The people with significant obesity rates did not do well. Survival dramatically diminished for many of those folks. So while how much of this is science-based, I think a lot of this is, taking care of yourself, following a regimen, improving your eating, but also addressing some of the comorbidities that people already have. So some of these comorbidities, we're not going to be able to fix them. A good example is hypertension or high cholesterol. I think following your doctor's recommendations around medication management are ways that people can keep themselves healthier. I do agree with Chris that many of the folks who we did see in the spring, lifestyles were a huge, significant factor for many of them. But I can't underscore enough of just obesity seemed to be a very common, and I'm talking obesity, we're talking 300, 400, 500, 600 pounds. Those patients, they just did not do well. And that I think was one of the most common themes we saw, at least in my organization at 2 hospitals. That was an overarching theme, was obesity played such a significant role, whether the patient improved or whether the patient did not do well.
All right. Ron, do you have any others in the queue?
I actually, no, at this time we are good. I am, like I said, actually, just as that was mentioned, Kev popped up into the queue. So let's take Kev's question, and then we're up against the end of the hour, so we'll give people a chance to close out. So Kev's question. So the Brits have started vaccinations and there are complications. It affects people who have had issues that require an EpiPen. Seeing as how they are in short supply, is the pending vaccine a concern to the healthcare professionals? As well as a veteran who has heard, okay, yeah, I'm sorry, he's side comment after acknowledging and thanking veterans for their service as well as healthcare professionals. But yeah, so the core is what's being seen in Great Britain and whether or not those concerns concern you, the panel, as well.
So Christian, someone watching this show or reading the news, what if they were to say, let's see what happens overseas first, then I'll get my shot?
So I'm not surprised that people do have that feeling. We've been watching that news. We try not to react to press releases. We like to.
What is your understanding, Christian, of what's happening overseas?
So our understanding is that there have been people who have been vaccinated recently who likely had an extensive history with allergies to medications and have had a reaction to that. I'm not entirely surprised that has happened. I think that because of that news, I suspect there may be some, report outs from the FDA when they review this tomorrow. But people who do have significant medication allergies, taking another medication, I'm not entirely surprised by it. But we will, as a matter of our processes that the state is requiring of us to do vaccinations. We will be watching. We are mandatory. We will be watching anyone who gets the vaccine. We will be watching them for 15 minutes after they receive the vaccine by a licensed healthcare professional, and we will have the equipment there should something happen to them. But we are watching it, but we are certainly leaving it to the science and medical community to provide us more information, not try to react to a press release.
Okay. Kourtney, what do you think? What if, why shouldn't someone just wait to see what happens overseas first before getting the shot here? What do you say to that?
Well, I thought you were going to ask me about the allergies, because I was going to say, Christian said it perfectly. Exactly. We need to see a little bit more hard understanding of what's going on. Observations are critical to science. So having people record observations and note that this is happening and make people aware is really good. But we need to really understand the basis before we can make concrete decisions about it. And allergies are no unexpected thing. We see warnings about egg-based vaccines as well. So if people have egg allergies, it's flagged right up front, because we don't want people to have adverse reactions. People can wait to see what happens overseas, right? This is a new vaccine. We're waiting to kind of see how well tolerated it is in the general public. And even though they do a great job trying to represent all demographics, the more information, the better. So somebody is justified in waiting. The data that will be discussed tomorrow and presented will be our best insight into whether or not this is a good time for you to get a vaccine. And we know that the risk of getting coronavirus is much worse than the vaccine as the data stands right now. So you're up against a virus that could make you very sick, ill, or even die, whereas the vaccine doesn't seem to have those same side effects.
Okay. Chris, let the community know, because I think there is some confusion. So overseas, it has been determined that it's safe to take the vaccine. Is there still a few more hoops here in the United States, or someone couldn't get the vaccine tomorrow, right? Even the first tier of who we're going to give it to, it's not approved yet, right?
It won't be approved. Tomorrow is the big day. That's when FDA will release their emergency, or if they're going to. Every indication is they plan on doing that. My spies tell me the vaccine has shipped. It's on its way everywhere. So these are, it's going to be here sooner than most people think. But I want to caution people, it is 3 phases. And depending on how well the vaccine handles the transport, which is a huge logistical challenge. I've heard of logistical challenge. You read about how these transportation companies move their equipment all over the country, and Amazon figures out how to get boxes to go in the right direction. It's one of those kinds of things, because these drugs are so delicate that one disruption in the supply chain, you could lose tens of thousands of doses in a truck. And that's going to change the schedule. And it's going to happen. I personally believe it's going to happen. Someone can be late at night, someone's tired and trying to do the right thing, and it's going to go wrong. That's usually what happens. It's going to be a measured response, and just as we've done everything, it's going to go in phases. Do your best to be active when your time comes. And I'm not going to tell anybody to take the vaccine. That's not my job or even my morals. I think do your own research. If you're a healthier individual, wait, give someone else a chance. Look at the data as it comes out. If you're one of the lucky people in our senior buildings where you're not, you're safe and you're got a good, reliable family group around you, you might want to wait a little longer, not too long, days, week, maybe, get some data once the vaccinations start. You're going to hear from it because it's going to be given to the hospital workers. They're going to be pushing that information out. Any adverse reactions are going to be known in days, not weeks, not months. So I think it's important to watch what's going on overseas, but I wouldn't stress over it. The epi manufacturers will rise to the occasion and manufacture more if the demand is there. They have a very reliable product and they get a very good price for it. They'll make more.
Okay.
I'm not worried about that.
All right. Well, we're at 8 o'clock. So why don't we have you close us out? And if you could, in each of your closing remarks, remind people the importance of the measures in place, because we spent a lot of time tonight talking about the vaccine, the logistics of delivering the vaccine. And I think some people may be seeing and reading about the vaccine and determining that the measures that in place are no longer needed. So if you can, as you give your final thoughts, let the community know why it's important to continue following the measures that are in place. So we'll start with you, Chris.
Well, it's, like I've always said, it's the simple little things that dull you to death, but are going to keep you safe, right? And ultimately, and I can't say that enough, young, healthy, good-looking guys like me don't have anything to worry about because our immune systems are up and we're in great shape. And, for those people, it's more important for you to do it because you could be infectious, not know it, and just feel a little run down and you're transmitting. It's still going on and it's not going to change anytime soon. I just want to give I wasn't going to really go into these numbers, but I think they're important for people to understand. We are in the upward turn of a surge. And right now, as we speak, there's 1,576 people in the hospital with positive cases of COVID. There are 308 people in the ICU. There are 162 people that are intubated. Now, that 1,500 people with 162 intubated doesn't sound like a whole lot, but intubation is not where you want to be. That 162 is what percentage of that is death and what percentage is recovery. All the decisions we make now are going to be what decides that if you're not following the basic guidelines and looking out for your neighbor. So if you don't want to look out for yourself, watch out for your neighbor, please.
Okay, very good. So Kourtney, vaccine is on the way. Why continue masking up?
Because our doctors, nurses, hospital workers, EMTs, pharmacists, front line of defense, they're tired. They are working tirelessly to keep us safe, and we owe them the biggest thank you. There will never be enough words or actions that we can give to show them our immense support and gratitude for putting themselves out in the line as our last line of defense. So we should wear our masks for them, for their safety, for our neighbors that we can't protect, for our loved ones, for everybody, for our community, because we care about our community and we care about each other. So please, everybody, say thank you to your neighbors, treat each other with kindness, and utilize the tools that we have in place because they are effective and they will do a good job.
Okay, very good. Thank you. And Christian.
I would just say that I have seen hundreds of people who have struggled to breathe through this whole horrible event since going back to March. My advice to everybody is keep yourself safe, keep your family safe, and for most importantly, your friends and neighbors who have lost their job because of the restrictions that have been, are important to be put into effect. They want to get back to work. We want to get our economies open. We want to get back to life as we know it. But the only way we can do that is to continue the measures that we have in place. And my hope is that the vaccine will be a light in this dark tunnel. But we're just beginning this process and we got a ways to go. So we have to, we're not in the home stretch yet, but the race is moving and we need to keep moving with the race.
Okay, very good. So on behalf of Ron Cochran, Malden Access Television, I just want to join our panelists in saying that You know, this thing is a marathon, not a sprint. Please continue to do what you can to help our city move forward. So again, on behalf of everyone here tonight, thank you for tuning in. Keep up the good work. We will make it.